Just for an introduction, if you don't mind, just share with everyone your name and what you do.
Yeah, so my name is Joel Munson. I'm currently the research coordinator at the Realm of Caring Foundation, but that's one function that I serve. I'm also a care specialist right now. Um, so previously we had just a dedicated care team and then some other department heads, but our team has recently consolidated and we're all taking phone calls and emails and then managing the departments on top of that. So.
All right. Well, in your own words, if you don't mind, just explain what ROC is and why it exists.
The Realm of Caring is a nonprofit organization that was built to help families that were out of medical options. And so Realm is actually an acronym. It stands for Research, Education, Advocacy, Improving Lives Through Measurable Results.
Nice.
Yeah. So we were founded by two mothers who had children with pediatric epilepsy, and they had tried all the pharmaceuticals and surgeries and therapies, and nothing worked. By happenstance, they had some CBD hemp available, and they found some reason to believe that it might help their children. And the first child, Charlotte Figge, responded extremely well. She had 99.9% seizure reduction, and the next kid that tried it had near similar results. And so that information spread very quickly in the epilepsy community with frustrated parents who couldn't help their children. And so very quickly people were clamoring for CBD and information about it and how to take it with other medications.
Sure.
And so we started to collect data on people who were using it, and we collected evidence. And our goal was to be able to help families with data-informed answers on how to best improve their quality of life with cannabis.
All right. How long have you personally been involved with Realm of Caring?
I have been involved for 6.5 years now.
Nice.
And so I've really seen it grow from the ground up since, Heather Jackson, she's our founder. I would go to her house and we would work out of her kitchen table, and that was our office. But we've come a long way. We have an office building and staff. Yeah, it's been awesome. It's been an honor, a blessing, and a very educational experience to be a part of it for so long.
I bet. What are some of the changes that you've seen in that time?
Relationships.
Okay.
The number of relationships we've been able to build has been fantastic. We've grown from 1 to 2 families to now 65,000 families we support. We have good relationships with universities like Johns Hopkins is probably our proudest one, and the research projects that we're doing with them. Relationships with, say, like Charlotte's Web, the Elixinol, Stratos, Aspen Green, the product companies that are exemplary brands that are raising the bar for the quality of products out there, and the influence we've been able to have in that.
Okay.
So yeah, before this started, CBD was not a household term, and now it is everywhere. So seeing that explosion has been incredible.
Nice. Do you have any particular success stories building off of that you'd like to share?
I mean, the best one for me, honestly, I'm sorry, it's kind of cliche, but would be Zakai, Heather's son.
Okay.
I didn't know the family before they tried CBD, but I've seen videos and pictures of Zakai when he had intractable epilepsy. And I met him when he was a kid, and he was about 10, and now he's 17. He's just grown into this big kid. Because of the medications he was on and the seizures he had, he's cognitively still closer to 10 than 17. Kind of what makes him so lovable.
Sure. Do you think that any of those previous medications affected that in any way, or do you think that it's just a end result regardless, the cognitive development?
I'm confident that the pharmaceuticals delayed it and stunted his cognitive development. Yeah, it's kind of unfortunate how many side effects come with the anti-epileptic drugs.
Sure.
Just in the name of stopping seizures.
Yeah.
There's no regard to the rest of their quality of life.
Right. Building on that, what are What are the worst symptoms that you see coming out of those pharmaceutical medications?
Just complete zombie-like nature,
Sure.
where you can't speak. You have almost no control of your faculties. You're drooling. I mean, it can really nearly paralyze you and just diminish your quality of life. So you can't interact with the rest of the world.
Sure.
And so I cry when I see kids who are like that. But then once they're able to come off those medications, and whether it's just moving on to just cannabis or even nothing at all, and you start to see their lives come back, and you start to be able to meet those humans for the first time, because they've been on medications during the time when normally you would see their personality start to develop, but they
Right.
didn't have a chance.
Sure.
But then you get to meet that person for the
Nice.
first time. Uh, so that, I would say, is definitely the biggest detrimental side effect that pharmaceuticals do to people that I've seen.
I couldn't think of a worse one. I really couldn't.
There's an accidental death, but I don't think I've seen that. So.
Fair enough. Well, what are especially with the work that you guys do, what are the main myths that you encounter regarding cannabinoid therapies?
It's hard for me to put myself in a naive person's shoes, everything I've seen, but
I feel you there.
it's that people think that CBD can cause intoxication.
Okay.
That's a big myth that should be dispelled immediately.
Absolutely.
Yeah, you can take CBD and operate heavy machinery and do your job. So it's one I would say is that you cannot test positive for THC if you're using a hemp CBD product.
Sure.
That's a myth. You can test positive. It's not a guarantee, but it's a possibility.
Right.
It depends on a few factors like how active you are, how much fat you have in your body.
Yeah.
So
I suppose the fact that it's just a maximum of 3% THC in the hemp plant, that there is still that possibility that there is THC even if every protocol is followed correctly. Is that right?
yes,
Okay.
there are. So nowadays they're using the term called full spectrum hemp,
Okay.
which means that it's at that 0.3%, like you said, but it still has some amount of THC. And so with prolonged use, it can build up in the system.
Okay.
And you can test positive. There's another type that they're calling broad spectrum.
Okay.
And this is otherwise full spectrum, except that they remove the THC content.
Okay.
And there's actually still not long-term research on whether you can test positive on a broad spectrum product or not.
Okay.
So there's always a risk, no matter what cannabis product you're taking. That's it. If you have to worry about drug testing and things like that for your occupation, if that's not a concern, then the THC content isn't enough to intoxicate you or anything else to worry about other than legal implications.
Once cannabis is not a Schedule I narcotic, then we probably won't have to worry about these things nearly as much. But how do you feel about the current scheduling of cannabis?
It's completely contrary to real-world facts. It doesn't meet any of the three criteria of the reasons that something would be in Schedule I. So yes, it's an attack on science and logic, and even on just humankind,
Read. Humanity, yes.
yeah, I would love to see it completely descheduled and just treated like alcohol, I guess, from the federal level, how they let each state run the program how they want to.
Sure.
You could have a state-run dispensary or let private companies do it, but we personally, and as the realm of caring, we want to see everybody have a chance to access cannabis if it's going to have a chance to improve their quality of life.
Sure.
We don't want to have that legal barrier in place from from you being well. It would be treated like an agricultural crop like corn or cotton, and it would just be very, very cheap and affordable. And there might be some kind of, Marlboro might come in and make their version of it joint, but then there's going to be the farmers markets where you can buy hand rolled, and
Absolutely.
there's going to be those niche micro organizations where you can still get organic, good quality, locally produced. Um, that's how I envision it.
There's a
And
vast and varied market there. There is.
yeah, yeah. Hopefully this can happen in 5 to 10 years.
Hoping so. With the fact that you guys are involved in research, which is incredibly surprising to me because the reason I'm going to school is eventually I'd like to be in cannabis research, and I know that there are roadblocks for that. Um, are you guys presently funding or conducting any research projects?
Yes, we are.
Okay.
The biggest one by far is the Observational Research Registry.
Okay.
This is in partnership with Johns Hopkins University. We've been enrolling in this study for 4 years now. It's survey based, so it's all online, and you can take it, on any device that has a browser. It's open to anyone in the world, as long as you're literate in English. You don't have to have a diagnosis or be using cannabis to be in the study, and
Okay.
we really want to enroll those individuals because they make a good control group.
Sure.
And anyone can join, just if you register on the Realm of Caring website, and you're eligible to request complimentary CBD products for participating. And so we have collected data, like I said, for the past 4 years, and we were actually able to be published this year based on data from this study. We were published in Cannabis and Cannabinoid Research, which is a new-ish research journal. It's peer-reviewed.
Okay.
But we're very excited to be finally published and legitimize the anecdotal stories that we've seen over the years. The first paper that came out was just the general synopsis, but the next paper we hope to publish this year will be on epilepsy specific. Because the study isn't partial to any one diagnosis, we've got hundreds of different diagnoses. So we can focus in on one subgroup and look at results, cannabinoid-based symptom outcomes, and use that to inform that population. That's probably the nearest and dearest population to our heart because how we were started. But yeah, we'll be excited to inform everything else from cancer to pain to dementia.
In conducting this research, and not necessarily this one because since it's online based, I feel like there's probably not many roadblocks to that, at least from the government side. But what are the roadblocks, if any, that you guys encounter when trying to engage in or fund cannabis research?
There's just a lot of red tape involved when you're trying to introduce cannabis to humans. There's a lot that we're not able to do that we would like to in the clinical setting. We can't tell people how much to take, and so it's unfortunately the quality of research we're able to get is less than we would like. So that's why we're resorting to an online survey. It's observational, but fortunately, what's kind of cool is we have been informed that we are doing the best available research under this legal framework that we live under.
Okay.
It was actually a compliment from the researcher, Dr. Raphael Meshulam. Okay. I'm not sure if you know who he is, the grandfather of cannabis research. We had a chance to meet him down at University of Colorado Pueblo when they held their first Institute of Cannabis Research conference. Nice. Dr. Meshulam actually flew over from Israel, and we got to meet him in person, and he gave us that compliment. He said, for what's going on, this is the best that you can do. So awesome. Good work.
Do you face any direct governmental influence, I suppose, in the direction of what you guys are doing, or in projects that you want to accomplish, or anything that well, I guess for lack of a better term, that you guys are uncomfortable with as far as governmental pressure or roadblocks or anything like that?
The question of freedom of speech is always at hand because it's interesting when we're talking with people and telling them what cannabis might do for them, the FDA might construe what we're saying as a claim,
Right.
whereas we would say we're only giving medical information. Um, and so that's been a tricky line to walk. We are what we are. We're an information hub,
Yeah.
and we disperse that for people to take that information and consult with their doctors and do what they will with it. It's been frustrating. One thing, just dealing with people that are taking CBD products, hemp CBD with low amounts of THC, but they're still testing positive, and we've seen people lose their jobs. We've seen people have their kids taken by Child Protective Services, all just for using a non-intoxicating therapeutic product.
Yeah,
That's been extremely frustrating
absolutely.
to see happen. Not that it impacts the organization directly, but our clients we care about, of course. We need to redefine the levels of drug place work
Yeah.
testing, or
Agreed.
workplace drug testing.
Absolutely. Or at the minimum, the methods, that's for sure. One thing that I really like about Realm of Caring is the research library that you guys have, and it's completely free of charge, and it's all peer reviewed. It's all scientifically backed. It's all correct information. How do you find that information to share with your patients and the medical professionals that you guys deal with?
We have access to a number of medical journals online, and we have good relationships with researchers who share their full text articles with us. So again, back to those relationships, we're very lucky to have positioned ourselves to be connected to so many people in academia. And so the way we add new articles is really organic. As we take calls with the new clients and they have a new condition or symptom, we help them research it right on the phone, or we research it and we get back to them. But then we stick the article right on our website and give them that full text information. And then it's available to show to their doctor if they want to print it out or whatever. But it's a really needs-based. Yeah, we're hoping that people can take that and do meta-analyses.
Yeah.
Because a lot of these articles, if you try to find them elsewhere, they might be behind a paywall. And
Right.
so if you've got this large aggregate of studies, then people can just take them and run a meta-analysis, and hopefully that can contribute to more broader research.
Absolutely, and I truly believe that free access to educational resources is probably the most important thing for changing how this country views cannabis and cannabinoid therapy. So you guys are awesome for that.
Thank you. Yeah, access to information improves your life. So that's what we're all about.
You got that right. Have you guys found any research in doing that support any negative effects of cannabis?
It's not without any risks. It's well, we've seen from the Epidiolex trials that extremely high amounts of CBD can cause liver toxicity.
Okay.
But they aren't using practical amounts of CBD in their trials.
Fair enough.
Uh,
Well, and then what are the toxicity amount or dosages of the pharmaceuticals that they've been giving these people?
that too. You have to compare it to pharmaceuticals.
Sure.
But to a naive user, high levels of THC can cause extreme discomfort, elevated heart rate, but it won't be fatal. That's the beautiful thing about cannabis.
Yeah.
You cannot fatally overdose from it. There can be drug-drug interactions. If you take THC or CBD at the same time as a pharmaceutical, it can lead to toxic buildup in the liver, or it can possibly diminish the effects of your pharmaceuticals. There can be contraindications if you have low blood pressure and you're already on a blood pressure medication. CBD acts as a vasodilator, so it widens those blood vessels. And so if you've got a thinning agent and a widening agent, then your blood pressure can drop to dangerous levels. So there's things like that that you have to look out for and discuss with your doctor. By and large, it's a very safe therapeutic substance, but depending on your symptomology and what other pharmaceuticals you're taking, there are certain reasons to be cautious.
Understandable. I mean, there's drug interactions with anything. But it doesn't sound like you found anything other than, you know, just absolute overdosing that causes liver toxicity, doesn't even cause death. But outside of that, and then of course THC, you know, panic attacks, things like that. But I don't think we have access to long-term health effects, at least as much as we'd like. But as far as short-term health effects, can't think of anything besides liver toxicity due to overdosing or, you know, the anxiety and things that you would get from THC.
In rare cases, people can have drowsiness, loss of
Yeah.
appetite, sometimes diarrhea from
Okay.
CBD. But sometimes we're not sure if that's due to the carrier oil or the other ingredients that are in the products,
Makes sense.
not
Yeah.
just the cannabis itself.
Yeah.
But as you mentioned, especially with CBD, we do not have long-term data because people have only been really intentionally taking it for the past 5 or 6 years or so,
Sure.
um, at least on a broad scale. There might be some grower in California that's had a CBD strain, for decades, but
Right.
as far as the world at large using CBD, we don't know all of the long-term side effects or outcomes, but we do know that so far the good is outweighing the bad.
Sure.
And that's what you have to take into account whenever you introduce a new medicine or therapy.
So just the fact that you guys are dealing in cannabinoid therapies, and I do work in the medical cannabis industry here in the city, and so I know kind of the ins and outs of advertising for our side of the business. Are you able to advertise your services in any way?
Um, Legally, yes.
Okay. Okay.
Financially, it's difficult. It's not something that we prioritize. Um, we've had access to free advertising dollars that we put to use, but we don't allocate much of our budget to that. Yeah, we can advertise that we have information and coaching
Okay.
and resources on our website. That's
That's better than
all.
I expected, truthfully. It really is.
Oh,
Yeah.
okay. Yeah, but we just have to, watch what we say and make sure it doesn't sound like we're making a claim, like we will heal you. We're not going to do that.
Yeah. The fact that you're able to advertise is kind of a nice way to engage people, to get them into your website, to get them thinking about cannabinoid therapies. But with the present environment with COVID and how you had mentioned that you guys haven't really been able to do community outreach programs, you haven't been able to do one-on-one counseling with people, things like that. How have your outreach efforts changed in the past 6, 8 months, however long that's been?
Well, it's really gone completely to virtual efforts.
Okay.
Um, we've ramped up our community connection events. So we have a weekly care team connect where you can connect with a care specialist and ask questions. We have a community connect for caregivers and practitioners for general information. We have an education on Mondays. It's weekly now. So just more online events, engaging the community that way. Um, it has been difficult. Like you said, we haven't had our normal annual golf fundraiser, so that was kind of a blow for us.
Yeah.
We're not sure if we'll be able to have our fall overcoming obstacles fundraiser that we have annually. So it has been a challenge.
Fingers crossed.
Thank you.
Yeah. But it sounds like you guys probably did a little bit more in virtual outreach before COVID anyway. Is that right?
We had some online educational programs. We always try to build community. That's one of our core functions.
Right.
Um, but I think it did pick up a little during this year.
Develop some new skills.
Yeah,
Okay.
got used to Zoom, that's for sure.
Agreed. Agreed. I had no idea this was a thing before February, so here we are. Do you guys have anything big in the works right now regarding research, education, or outreach that you can share any details on? Anything that either just started or is maybe coming this fall, or maybe once COVID does finally decide to go away?
Um, I would say the biggest thing to share with you is that we're partnered with a new data scientist team.
Okay.
It's going to be able to um, basically centralize all of our data, whether from all of the historical records from the phone calls with our clients, whether it's any of our old research studies or the current ORR,
Nice.
And they're going to pull this into a database and be able to apply machine learning and um, and just gain incredible insights that we don't even know
That's
what's in
awesome.
store. There could be some huge insights, and they're going to be able to just automatically run reporting, and it's going to facilitate getting more research papers out, because we're
Nice.
sitting on all this data that's publishable, but we need to run it through something. And
Yeah.
so this machine that we're building is just going to be able to pump out stats and figures, and it's going to be a very useful tool, we think.
Absolutely. Yeah, that's awesome. Any ideas on when that might come about?
We will have our fingertips on it actually next week
Oh, wow.
to start to play with it.
Okay.
Um, so I think by the end of this year, it could be in full force.
Okay. Yeah, moving
Definitely
fast.
in 2021, it should be an active machine that's pumping out very useful information.
Well, the last question that I've got for you, and again, I sincerely appreciate your time doing this. What is
Yeah.
your hope? Yeah.
Oh, sorry.
What is your hope for the future of cannabinoid therapies? What do you see 10 years from now? What is your dream 10 years from now?
Genetic matching to cannabinoid profile and terpene profile. So if we can sequence the cannabinoid receptor genetics and figure out what deficiencies lead to what conditions, and which cannabinoid ligands are, best suited to target specific symptoms that you personally uniquely have, um, that would be, you know, that's maybe a pie in the sky
Yeah.
idea, but I think it should be possible, and that would be ideal, really.
Speaking on that, I could definitely go. We could sit here and talk about that forever. But I'm sure you've got plenty to do, and I do. I need to actually get work on my second project for this class, so I'm going to let you go. But I do sincerely appreciate your time.